911 call takers are trained first responders. When you call 911, they will ask you a series of questions starting with your location. They can guide you to administer first aid to your loved one, if necessary, until help arrives. When you call 911, it may be a traumatic situation for you. Stay calm, let the phone ring until a call taker picks up.
Stamford 911, what is the address of the emergency?
We only want people to use 911 in the case of a true emergency, and it's always up to the person to decide what a true emergency is. But when you do dial 911, we would ask that you make sure you know where you are. We need an accurate location so that we can send you the help that you need. We're always going to ask for a telephone number, so if we lose you, we can call you back. And thirdly, try to tell us as clearly as possible what the problem is so that we can send you the right help.
And his breathing was not completely normal in an apartment or floor?
We do also offer a service called text to 911. So in a situation where you have an emergency and you're not able to speak for whatever reason, you can dial 911 by texting 911. We're going to need the same information. We're going to need your location and the problem.
The most important thing the public should know about 911 is that when they call, the location is absolutely what we need the most. If they hang up or disconnect the call, at least we have the location and we can start sending help right away.
So when you call 911, you're going to talk to a dispatcher. They have a whole bunch of questions they're going to ask you. Really important for us to know your current signs and symptoms, what made you call, how long it's been going on for, and if there's any past history that goes along with it. If you're having chest pain, do you have cardiac history in the past? Also, how long it's been going on for, and any other pertinent information.
How old is he? And you're not even sure if he's awake and breathing?
We first have to make sure that the scene is safe, whether that's, again, a crime of violence, a car accident, or anything in between. So if the scene isn't safe, we first have to make sure that we address whatever is causing the danger before we can administer aid and begin the investigation.
When we arrive at your house, we're going to pull up, park outside, find a best entry exit way for us to tell dispatch when you call. If there's a certain door that you want us to use, if there's an easier way for entry exit, that would be really helpful. When we enter, we ask you what's going on, what made you call 911. Was there an event? Did someone fall? Or did symptoms start happening? It's helpful to tell us if it's an acute or chronic issue. Let's say you've been having pain for a couple weeks, couple months, or the pain just started suddenly. We'll ask you any other signs and symptoms, past pertinent medical history, and any medications that you're taking as well.
When we made it safely to the person's house, there are certain things, if you could get that ready in advance, that would be great. A med list, because sometimes we don't have access to the hospital medication, like the information you have at the hospital. It would be great if we could have a med list. And second, if you have any pets, if you could secure them.
So when you call for service, like you have some condition in your house or your building where you are calling for a fire condition, a smoke condition, active flame, active fire, what you want to do is you actually want to get out of the building. You want to get out yourself. You want to get out and you want to stay out. When you go outside, you want to get to a place where you could actually meet the incoming fire units. We normally get there in a matter of about 3 minutes. So you have to give them some direction of what type of condition. So if you give them an apartment number, you give them some direction on how to get there. If there's someone else in the building that you know about, or someone might be trapped in the building, let the incoming fire units know that. Make them aware. Don't go in. If you're out, we want you to stay out. That is the best policy for us.
happens that folks do dial 911 by mistake. And if it does happen to you, we would ask that you please stay on the line and explain to the operator that it was just a misdial, an accident. That's good for us to know, because if you were to hang up before we answer, then we have a duty, a responsibility to call you back.